What we typically use in our office for fluoride is two different types. We use the acidulated phosphate fluoride, and we also use a neutral sodium fluoride. I'm going to start with the neutral sodium fluoride. This is the one we will traditionally use for adults. This is used whenever somebody has quite a few dental restorations. This is a lot easier on it. The way this works is at the end of a prophylaxis appointment or any type of cleaning appointment, you're going to have the patient take, we'll do 2 pumps of fluoride, then you'll have them stand and they're going to put it in their mouth and swish it without swallowing. You'll have them do that for 1 minute. You want to be sure and time them. When the minute's complete, just have them spit it into the sink and ask them not to eat or drink for 30 minutes. And that will help strengthen their teeth for a good long time. It's especially helpful for people with recession. The other type of fluoride that we'll use predominantly on children, some adults will request it because it's got a foamy consistency, is the APF fluoride or stannous fluoride, whichever you like to refer to it. For children, what we will do is we will put it into trays. You will notice on the trays, I'm going to use this blue one, it's easier to see. This one will be used for a larger teenager or a young adult. There is a U that's for the upper arch. So you'll fold this over when you put this tray in. I usually shake it to get it to be a little bit thicker, and you're going to squirt it into the tray like this. You'll notice that it grows, so you're not going to want to fill it up to the top. It'll do that on its own. You can either wipe some of that off, but I will traditionally go ahead and put it in their mouth and then wipe it. That way we get it all around the teeth. The best way to do this, once spits we can. Once they do that, then what you do is you'll take it, you will put it into their mouth. It'll be hard to do. These are flexible, they bend. Put it in their mouth, have them open. You will stick this right here in between, like this, so that when they're biting, it's in their mouth. And then they will keep this in their mouth for 1 minute. Make sure they're not swallowing it. It can really upset their stomach if they swallow it. Once that's done, then you'll have them, you can spit out the rest of it, no eating, drinking for 30 minutes. Be sure and tell mom and dad that, since we're going to use this on kids. The biggest thing is make sure that the tray size is appropriate for the size of the mouth. If you get too big of a tray and too small of a mouth, they'll gag and it won't have proper application. So those are the 2 ways we use our fluoride. Lots of flavors, mint and all kinds, and then this one's just mint. So there you go. Have fun with fluoride.